Hi, my name is Michael Opara. I'll be the student doctor seeing you today for your cleaning. What's your name?
Francesca.
Hi, Francesca. You can come over this way. Okay, so we've done that head and neck cancer pre-screening where we checked out your lymph nodes of the head and neck area. Everything seemed good there. We also got your health history and your current medications taken down, looking all good there. I kind of just want to start out with the open-ended question here. I see that you're a pretty healthy person. I see that, with your exercise and your diet, you take care of yourself. So when you're looking at your long term, I know you're young, 18 years old, but when you're looking at your health, what do you think you value in your in maintaining your health long term?
I just want to make sure I work out, that I drink lots of water, that I take my vitamins. That way I can be healthy.
Okay. So I'm hearing a lot of kind of preventative measures, I would say. Exercise will keep you healthy, keeps cardio is good for the heart. So would you say that you're more prevention focused when it comes to health issues, kind of preventing it so you don't have to treat it later in life?
I guess you could say that.
Okay. Looking at your health history, I'm seeing that you're vaccinated for mostly all the recommended vaccines that we have from the CDC, but you're missing the HPV vaccine, the human papillomavirus. I was just wondering if that was something that just kind of got missed. Normally they're done around 11, 12 years old, so when you're a little bit younger. But I didn't know if that was kind of like a missed appointment you had back when you were a kid, or if there was a decision to skip out on that vaccine.
Yeah, when I was a kid, my parents didn't want me to get it. And then once I turned 18, they told me that I should get it, but I'm not sexually active, so I didn't see the point.
Okay. Yeah, I can understand that. If it's a STI vaccine and you're not sexually active, you might think, what's the point? But HPV can actually and lead in many cases to oropharyngeal cancer in addition to, the anal, penile, and vaginal cancers. But it can also lead to oropharyngeal cancer, which is why us in the dental field are kind of concerned about and have that worry when people aren't vaccinated because around 70% of oropharyngeal cancers are actually linked to HPV. So it becomes a big, health risk issue when we have, a large number of patients who aren't vaccinated against this condition. We know that the majority of a cancer, serious condition are linked to something that we can prevent now with this vaccine. So would you think that'd be something that you'd be open to, or have you ever heard of that kind of risk of oropharyngeal cancer with HPV, or did you only think it's a STI? I'm not sexually active, so I don't need it.
No, I've never heard of that. I thought it was just a STI, and they said I could get like cervical cancer or something, so I didn't think it was important. But from what you're telling me, it sounds important. I would be open to getting it, I guess. Have you had it?
Yes, I've had it. I've had all my recommended vaccines. I keep a pretty accurate list. I try to, it's the same as you. I try to maintain my health as much as I can. Because I've seen, as a health provider, I've seen the other side when it comes to treating conditions. So I also agree with you in that prevention is the best method that I use to keep myself healthy. And I just kind of, outside of my personal belief, I feel like the research also backs it up. Research is showing that the annual number of oropharyngeal cancers is on the rise, and approximately 90% of those newly diagnosed HPV attributable cancers could have been prevented had those patients received the vaccine. I think there is a lot of, misinformation. People might think that things don't apply to them. But I think, and the same way that you think, when you're coming from a base of, preventing issues before they become an issue, I feel like even with you not being currently sexually active, there still is, the potential of you becoming active in the future. Or maybe, there is, potential risk from previous partners if that were the case here. But I think that when we're looking into prevention and looking at the way that you prefer to maintain your health, I think that we should stick with prevention. And I think that it'd be a great idea to get that HPV vaccine for you.
Okay. Do you guys do that here?
We don't do it here, but we have a list of certain health clinics that are that are local to the area. Some are pretty close to here. We can send you over to Truman Medical Center right across the street. They can get set up. They can get you set up at the outpatient clinic, get your vaccines updated, and get that all squared away for you.
Okay.
All right.